Today, we are going to look at a BodyViz brain builder all about kidney stones. A simple definition of kidney stones are small stones that are formed in the kidneys and can block urine from passing through the body. This can cause a lot of pain. Kidney stones are also called renal calculi, nephrolithiasis, or urolithiasis. A deeper anatomical explanation involves the renal, medulla, renal cortex, renal sinuses, and ureters. The kidneys are a bean-shaped pair of organs in the abdomen that excrete waste and extra water from the body and help keep other chemicals balanced in the body. The kidneys are composed of three main structures: the renal cortex, the renal medulla, and the renal sinuses. The renal cortex houses and protects the inner structures of the kidneys, which are the renal medulla and the renal sinuses. The renal medulla are small funnels that filter and concentrate fluid into the renal sinus. The renal sinus is a collecting space that passes urine from the kidney into the ureters. A simple way to remember the difference and placement of these three inner structures is that they are alphabetically in order from the outermost to innermost structure, with the outermost being the cortex. The cortex keeps the insides cozy. The medulla is the middleman, and the sinus slides the fluid out. The ureters are tubes that transport urine from the kidneys to the bladder. Kidney stones are formed when the salts and proteins meet in the renal medulla and crystallize in higher concentration than the kidneys can dilute and filter through. This creates kidney stones, which are typically difficult and quite painful to pass. Next, we will look at the symptoms, causes, and treatments experienced with kidney stones, and finally, give a patient example. Symptoms patients with kidney stones experience include severe, sharp, and/or waves of pain in the side and back, right below the ribs that fluctuate in intensity. Radiating pain from the lower abdomen to the groin. Pain or burning sensation while urinating. Pink, red, or brown urine. Nausea and vomiting. Fever and chills if an infection is present. There is typically not one cause of kidney stones, but many factors can increase someone's risk of having them that include family or personal history. If someone in your family has had kidney stones or you have had them before, you are more likely to develop them also or again. Diets high in protein, salt, and sugar. Dehydration, including those who live in hot environments and sweat a lot. Excess body weight. Specific supplements and medications, including vitamin C, dietary supplements, laxatives, calcium-based antacids, and certain medications used to treat migraines or depression. Treatments that doctor may recommend depend on the size and type of stones. Treatments for small stones include drinking water to dilute urine, pain relievers to help in the passing, and medication, including alpha blockers to relax the muscles in the ureters and assist in the ease, speed, and pain of passing kidney stones. Treatment for larger stones include using sound waves to break up the stones. The strong sound wave vibrations break the stones into smaller pieces that can be passed. Or surgery to remove the stones, either directly or with a scope entering through the urethra into the bladder up the ureter for removal. Oftentimes, a small tube, called a stent, is placed in the ureter to relieve swelling and assist in healing. Finally, let's take a look at a patient example. You receive your patient's file and take a look. Age, 43. Gender, female. Chief complaints, severe back pain, discolored urine, and nausea. You invite the patient into your office for an examination and ask her about her lifestyle. She reports that she is extremely busy and on the go with work and her family, so often she eats fast food. However, she tries to make up her poor diet by working out and going to the sauna daily. You ask her about her history of urology or digestive issues in her family. She says that her grandmother and father both have had kidney stones before. You order a urine sample and MRI to determine the size and number of stones she has. This is a classic example of kidney stones. For more 3D anatomy videos, like this video and use the links on your screen to subscribe to our channel.